everyone, and welcome to another video on my channel, The Real WebMD here. Today's video will not have a post from Reddit. It will be a different kind of video. I'm gonna just talk about, I've seen a lot of posts on AskDocs about people asking for help with their lab tests. So I thought I'd make a video explaining how to read or how to look at a CBC, or also known as a full blood count, so FBC, in some parts of the world. Okay, so a CBC or FBC, as it is known, is a test that is done by taking some blood, running it through a machine. This machine is going to take a look at all the stuff that's inside the blood, all the cells, and give us these numbers that you can see in front of you. And I'm going to go through these numbers and explain what these things are so that you can understand just like what is this test and what is it looking at. So as I said, it's looking at the cells in the blood, and these can be divided into three different parts. We've got the red blood cells, which are the cells that carry oxygen. We've got the white blood cells, which are the cells that fight infection, and we've got the platelets. So for the red blood cells, what you need to look at, the three main things are the RBC count, the hemoglobin, and the hematocrit. The RBC count measures the amount of red blood cells in the blood. The hemoglobin measures the amount of hemoglobin in the blood. Hemoglobin is the protein that's responsible for carrying oxygen in the blood cells, so it's very important. And the hematocrit is the ratio of red blood cells to the total volume of blood that you have. These three things are used to look at your oxygen carrying capacity and the amount of blood cells that you have generally, red blood cells that you have generally. So if you have an increase in these, then you have more blood cells or more hemoglobin, basically more oxygen carrying capacity for some reason. If you have less of these, and they come hand in hand, all of them. If you have less of them, then you have anemia, which is a decrease in the amount of blood or oxygen carrying capacity. The second thing to look for in the red blood cell measurements are the other things. These give us an idea of what could be causing potentially the anemia that you might have. So the MCV is the mean corpuscular volume. It's the average volume of red blood cells, and it gives us an idea of what the anemia, if you have an anemia, could be caused by. There's different anemias change the volume of the red blood cells, the average volume. So, for example, in iron deficiency anemia, you would have a lesser volume. We call that microcytic anemia. If you have vitamin B9 or B12 deficiency, you might have a larger volume red blood cells. So you would have less red blood cells, but the ones that you would have would be a higher volume. We call that macrocytic anemia. MCH is the average mass of hemoglobin in each blood cell, and MCHC is the average hemoglobin concentration of all the blood cells, the red blood cells. These two are not very important for lay people, and even for most doctors. We don't really use these. They're mostly used by specialists. Reticulocyte count, which are not available on every single blood test, every single CBC, are the amount of reticulocytes in the blood. Reticulocytes are newly formed blood cells, and they increase if you have a blood loss or some reason why you would have an acute loss of blood, for example, hemolysis or blood loss. And then finally, you also have the red cell distribution width, which measures the variation in red blood cell volumes, which gives an idea of how variable your blood cells are. So, for example, some people would have differing shapes and sizes of red blood cells. Some people would have uniform, and it should be uniform. If it isn't, then there might be a problem. But yeah, basically that's it for the red blood cells. Now, for the white blood cells, first you need to look at the total count of white blood cells. If they're above 11,000, we call that leukocytosis, which is an increase in white blood cell count. This could be caused by several things, for example, infections, um, some autoimmune reactions, some drugs can cause this, and of course, some kinds of cancer. Of course, rarely it would be cancer. Most of the time, it would be an infection. Now we would look at the now we would look at the specific white blood cells. So you've got neutrophils. These are mostly responsible for fighting bacterial infections. So if they're increased, that gives us an idea that the infection, if there is an infection, is bacterial. If it's decreased, the neutrophil count, like very decreased to the point where it's neutropenia, where you have an absolute neutrophil count less than 1,500, that means your immunity is compromised, and such patients are usually considered high risk. Other things could cause differences and changes in the neutrophil count. I'm not going to go into that right now. Just know that mostly it's for bacterial infections. The eosinophil count and the basophil count, these two cells usually rise and drop together. They mostly, especially the eosinophil count, changes in response to asthma or in response to allergies and parasitic infections and some other causes like drugs or fungal infections. The lymphocyte count usually rises in response to viral infections. Um, Mostly it's that. So if there's a change, and it can even drop in response to viral infections. For example, COVID is known to cause a decrease in lymphocyte count. The monocyte count is usually increased in chronic bacterial infections and in some parasites. The platelets are responsible for clotting, and they can range between 150,000 and 400,000. If they're less than 150,000, then you have a decreased number of platelets, and this could be for several causes. If they're above 400,000, then you have increased number of platelets, and this could also be for several causes and should be investigated. Um, so basically, that's it. Sometimes we might order a peripheral blood smear if we have problems with the CBC, and that would give us a better idea of what's going on. So what happens is the lab doctor would take a look under the microscope at your blood cells and try to describe what's going on, and that would give us an idea. I'm not really going into much detail. I'm just quickly explaining things to you all. I feel like sometimes people see, for example, a decrease in the MCV and they immediately panic, but it's not important as long as you don't have a decrease in the hemoglobin or the hematocrit or the red blood cell um, count. So just wanted to clarify all that and for you to understand how we look at these and what is important and what is not important. If you have any questions, please leave them in the comments below. Until next time, this has been The Real WebMD, and keep it real, everyone.